The sustained-action tablet form of Etodolac Er is used to reduce pain, swelling, and joint stiffness from arthritis. This medication is a nonsteroidal anti-inflammatory drug, NSAID, that works by blocking your body's production of certain natural substances that cause inflammation. Reducing symptoms of arthritis may improve your ability to move, exercise, work, and perform tasks normally. It's important to ask your doctor about non-drug treatments and/or using other medications to treat your pain. The recommended daily dosage and optimal timing for taking Etodolac Er should be discussed with your healthcare provider. Before taking Etodolac Er, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily with a full glass of water. Do not crush or chew the tablets, and do not lie down for at least 10 minutes after taking this medication. If you experience stomach upset, take it with food, milk, or an antacid. The dosage of Etodolac Er is based on your medical condition and response to treatment. To reduce your risk of side effects, take this medication at the lowest effective dose for the shortest possible time. It may take up to 2 weeks of taking this drug regularly until you get the full benefit. Make sure to tell your doctor if your condition gets worse. If you experience upset stomach, nausea, diarrhea, gas, weakness, drowsiness, dizziness, or blurred vision, make sure to tell your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, it's essential to monitor your blood pressure regularly and report any high results to your doctor. Be sure to seek immediate medical attention if you experience hearing changes, mental/mood changes, easy bleeding/bruising, difficult/painful swallowing, symptoms of heart failure, or signs of kidney problems. Additionally, if you notice symptoms of liver damage or a serious allergic reaction, it's crucial to seek medical help right away. Always consult your doctor or pharmacist if you notice any other effects not listed. Nonsteroidal anti-inflammatory drugs, like Etodolac, may rarely increase the risk of a heart attack or stroke. This can happen at any time while taking the drug, especially if you take it for a long time. The risk may be higher in older adults or if you have heart disease, smoke, have a family history of heart disease, or have conditions like high blood pressure or diabetes. It's important not to take this drug right before or after heart bypass surgery. Additionally, Etodolac may rarely cause serious bleeding from the stomach or intestines, which can occur without warning symptoms. Older adults may be at higher risk for this. If you experience stomach or abdominal pain that doesn't go away, black or tarry stools, vomit that looks like coffee grounds, chest, jaw, or left arm pain, shortness of breath, unusual sweating, confusion, weakness on one side of the body, trouble speaking, or sudden vision changes, stop taking Etodolac and seek medical help immediately. It's crucial to talk to your doctor or pharmacist about the benefits and risks of taking this medication. And always take it exactly as prescribed by your doctor. Before taking Etodolac Er, it's important to discuss any allergies with your doctor or pharmacist. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's also important to share your medical history with your doctor or pharmacist, especially if you have asthma, blood disorders, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus problems. Kidney problems can occur with the use of Etodolac Er, especially if you are dehydrated, have heart failure, kidney disease, are an older adult, or take certain medications. Be sure to drink plenty of fluids as directed by your doctor to prevent dehydration and notify your doctor if you have any unusual changes in urine. Etodolac Er may cause dizziness, drowsiness, or blurred vision. Avoid alcohol or marijuana, as they can worsen these effects. Do not drive or use machinery until you can do so safely. This medication may increase your risk for stomach bleeding, especially when combined with daily use of alcohol and tobacco. Limit alcohol and stop smoking. You may become more sensitive to the sun while taking this medication. Limit your time in the sun, use sunscreen, and wear protective clothing. Notify your doctor if you experience sunburn or skin blisters/redness. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at greater risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using this drug. Women of childbearing age should discuss the benefits and risks of using this medication with their doctor. It's important to inform your doctor if you are pregnant or planning to become pregnant. This medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. You should not use this medication after 30 weeks of pregnancy. It is unknown if this medication passes into breast milk. Consult your doctor before breastfeeding. When taking Etodolac Er, it's important to be aware of any potential drug interactions. This medication could interact with other drugs, increasing the risk of serious side effects or affecting how your medications work. Some products that may interact with Etodolac Er include aliskiren, ACE inhibitors, angiotensin II receptor blockers, corticosteroids, lithium, methotrexate, and certain water pills, diuretics. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It's important to be cautious and discuss any potential interactions with your healthcare provider. Furthermore, it's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers that are similar to Etodolac Er and may increase the risk of side effects if taken together. However, if your doctor has directed you to take low-dose aspirin to prevent heart attack or stroke, you should continue taking it unless instructed otherwise. Lastly, it's important to be aware that this medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors are aware that you use Etodolac Er. If you suspect an overdose and notice severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, slow or shallow breathing, and extreme drowsiness. If you or someone you know experiences these symptoms after taking Etodolac Er, seek immediate medical help. Etodolac Er is a medication that should not be shared with others. Your doctor may also perform lab tests such as complete blood count, liver/kidney function, and blood pressure while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, making lifestyle changes such as weight loss if needed, and doing strengthening/conditioning exercises may help improve your flexibility and joint function. It's important to consult your doctor for specific instructions on how to incorporate these changes into your daily routine. If you forget to take a dose of Etodolac Er, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the regular time. Don't take a double dose to make up for the missed one. Remember to store Etodolac Er at room temperature, away from light and moisture. It's important not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you have any questions about how to dispose of Etodolac Er, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.